The Prime Minister also did, as I mentioned, announce $240 million directed towards online services for both primary health care and mental health care. For that, I want to bring in our next guest, Dayna Lee-Baggley. She's a registered psychologist in Halifax. Hi there, good to see you.
Hi, thanks for having me.
I want to start off with the idea of online services for mental health care right now. So many people having to stay home. How significant or how important is it that they be able to access those services through their computer?
Yeah, so I think one of the good things that came about, and I wish it could have come about in a different way, but one of the good things that came about is an increased focus and attention on mental health and on being deliberate about protecting our mental health. So the physical distancing is absolutely necessary, as we just heard, and it's also really hard on mental health, right? These are not the things that we recommend for good mental health. And so I think it's especially important to be able to access professional services. So these are unprecedented times, and that might also mean that we do things we wouldn't normally do in terms of accessing professional mental health. Mental health translates very well online. You can do therapy quite well. There's studies showing the effectiveness of that. And we also need to make sure that the rural communities have access to the internet, because those are exactly the communities we want to increase accessibility. And often they don't have stable internet to be able to make use of these resources.
That's a really good point. Actually, it's been the point of discussion among parliamentarians and specifically from the opposition parties, too. You run your own practice. What have you seen up close about the effects of this pandemic on Canadians' mental health?
So really, it's pretty much the only thing we talk about in all of the sessions is how to protect our mental health, how to stay stable. We're talking about trying to, again, charge our batteries, do things that are deliberate about protecting our mental health. So it is taking a toll. We've seen some studies showing that it's taking a toll, and also that people are willing to continue doing it if that means keeping people safe. So having additional services that you can access and professional services you can access to help us cope with that is really important.
I just have about a minute left, but my sense prior to this was that access to those services was already strained. It's already an issue for a lot of Canadians. This is more money, but how big of an issue is that access?
So I've seen, people talk about that the first wave is COVID deaths. The second wave is acute deaths like heart disease or heart attacks. The third is chronic disease management, so people that didn't get services. The fourth one is mental health, and it's going to be the longest one. It's the one that we're going to be having to deal with long past when the actually outbreak is done, because there will be long-term consequences, both for the public as well as for essential service workers and frontline providers. And so we're going to need to be mindful of this for a very long time to come.
We sure will be. Thanks very much for sharing your expertise with us today. Really appreciate it. Dayna Lee-Baggley. She's a registered psychologist in Halifax.